Yes, I have my colleague, Dr. Naji Azuka, who will be working with me on that today. She's also on the call.
Right, great.
Good morning.
Hello. So what we'll do is, Prosper, if you can start by introducing yourself, and then your team members can also introduce themselves and the role that they play in different ECHO programs. And then we'll go one by one to each of you to talk about different roles, and then we'll move forward, right? So Prosper, over to you. You can start by introducing yourself and your team members.
Okay, so it's nice to be here. Good morning, everybody all over the globe, connected from different countries. My name is Prosper Onyekachukwu, and I am the ECHO lead for Nigerian project. And working with me, two persons from my office. We have Dr. Naji Azuka, and then we also have Miriam Olawere. Maybe I would just want to allow them to introduce themselves. Dr. Naji, please, can you go first?
Yeah, good morning, everyone. Hello. My name is Dr. Azuka Naji. I'm the coordinator of the West African Regional ECHO, which is based here in Nigeria as the hub. Glad to be on this platform.
All right, thank you. Can we have Miriam Olawere to introduce herself? Miriam, please, over to you.
Good morning. Hello, good morning, everyone. I'm Miriam, and I'm the one in charge of the data analysis, as in preparing the reports and doing the data for both WER and ECHO here in Abuja.
All right, thank you very much. So that's our introduction. So what next are we going to do?
Yeah, I think from Sudan team, we also have Dr. Abrar with us. Dr. Abrar, would you like to quickly introduce yourself?
Oh, yeah, thank you so much. So hi, everyone. Good morning, good evening. It's Abrar Al-Halim from Sudan. I work at Sudan Eco Center of Excellence and their SUDRUP, the Sustainable Response Development Organization. We're leading many eco hubs, and I am an eco coordinator as well as the monitoring and evaluation coordinator in our Sudan Eco Center of Excellence. Thank you so much for having me today.
Great, thank you so much. And so I think for all the participants who are with us today, I think you have a lot of expertise in this role panel session with us over here. So the idea is you can first listen to them. What roles do they play? What are the responsibilities that they have as part of the ECHO Hub team? And then we'll open it up for discussion with you all. You can ask them questions if you have any discussion points. If you think you want to discuss maybe some potential challenges with these Hub team members, because they're already running ECHO programs. So you can have that level of exposure by talking to them over here, right? So we also have our team member, Ms. Anchal Chauhan, who will talk a little about the IT support in this role panel. So I just like to start by thanking all the panelists for taking out the time to do this. And I'll first of all pass it on to Prosper, who can talk a little bit about his role in the Hub team and the ECHO program. Over to you, Prosper.
All right, thank you very much again. And so for us in Nigeria, we have two ECHO programs. We have the SPICE ECHO program, which is focused on HIV and AIDS intervention, treatment and management, and it's focusing on Nigerian, on all the health facilities that are providing HIV services in Nigeria in about 19 states out of the 36 states. And then we also cascade to other states. And then we also have the West African Regional ECHO, which was conceptualized during the COVID-19 lockdown. It was a platform that we used to train incident managers, train health workers across Nigeria to provide services to HIV and AIDS to build their capacity to be able to train and manage COVID-19 cases. So these are the two programs we run in Nigeria. And as the ECHO lead, okay, but let me just take the role of a facilitator, and my colleague will talk about on the coordinator. So as a facilitator for the SPICE ECHO, it happens every Thursday. The background work that we need to do every Thursday is just like I've already done some today, is to prompt the supposed subject matter expert ahead of time that your presentation would be happening today. We also will also send him the timing, the topic, and every other information he needs to use to provide, during the session. And then ahead of time, of course, we have it scheduled. So there will be a prompting. They will be reminded of the time. And then in Nigeria, for us, we usually have CDC, that is US Center for Disease Control, give a good way message during the session. We have the government of Nigeria, who is like the pilot or taking leadership of the program, also give an opening remark. So all these people would have been pre-informed before the ECHO session will start. So as a facilitator, I would inform all these people before time, and then on the day of the ECHO session, the facilitation proper is to, as soon as the session starts, I will come on board, introduce myself, and then my team members in the ECHO room. And already every team member know their role. Like we have Miriam, who is working on our data, and then doing a lot of things behind. And then some persons are there to meet people in case of those who are not able to meet themselves, and then any other side distraction, in the ECHO room. And then I will introduce myself and names of my team members, and possibly give a ground rule, which our usual ground rule is to tell them that all the hospitals or facilities connected on the call should please mute themselves, turn on their camera, and then remain muted until when they need to ask questions. They can now use the Zoom platform to raise their hands or send in their questions through the chat box. So those are part of the rules that we usually and then also we take attendance. So we ask them to please send in their attendance via the chat box, including their name, their role in the facility, their phone number, which serves as a unique identifier for every participant. And they will be sending all this in on the chat box. And then I will now start by calling those who will give the opening remarks. In our own case, the Federal Ministry of Health, they will give opening remarks. After the Federal Ministry of Health, I will call the CDC Nigeria to give a goodwill message. After that is done, and then I will now introduce the topic of the day. Like today we'll be looking at viral genotyping, looking at management of drug resistance for HIV patients. I'll introduce the topic, and then the next is to introduce the subject matter expert who will be speaking to us on that topic. And after the introduction of the subject matter experts, and then I would also let the subject matter expert know how many minutes he has for the presentation, so that he will work with time, because we do ours here just 1 hour, and we try to keep to that 1 hour, and then at the end of the presentation, the subject matter expert will usually tell me, okay, we are done with the presentation. I will now come in again and take questions, and then call people that want to ask questions. In a situation whereby people don't have questions, which many a times you have that case, you have to stir them up. Either you raise questions just to stir them up to be able to ask questions, and then that is it. And secondly, there is also what we call, when we do case presentation, that is facility case-based presentation. It's a little bit different because we have 2 panelists that will provide perspective after each presentation. So when we have case-based presentation, we have the facility, that is one of the hospitals that we are building their capacity to come and tell us what it is they have done. It could be that they have been able to successfully manage maybe TB HIV co-infection, or maybe treatment failure that they have managed successfully. So it is now people no longer the subject matter expert. And then when they are done presenting, or the day we are going to have such case-based presentation, we usually invite two panelists. Like in our own case, they are professors and medical and doctors. So their role is, after the presentation, they provide further perspective, know whether these people made mistake, know whether the procedure and the approach they use in the management of certain cases were in order. And in the course of when we have such, we usually also introduce them that these persons will be serving as a panelist at the end of the presentation with their designations and their areas of expertise, introduce both of them. So they are already on the call, introduce them, and the participants are aware that after the hospital or the facility finishes presenting, that there is a role, there are panelists that will talk. So after that, we invite the panelists to give further perspective to the presentation as well as further guideline. Then after that, we'll now open up the floor for questions and answers and contributions. So I just explained the two program area we do in SpiceEco as a facilitator. And then we'll take questions and shortly we'll close the session. So I think that I will stop here for now. Maybe if I am called again, or if you want, Dr. Azuka will go on and talk a little bit about coordination, because she coordinates the West African Regional ECO, alongside with me. We all work together side by side. So do you want us to call Dr. Azuka right away, or you want to continue before we call her?
Yeah, so I'll quickly just summarize over here. Thank you, Prosper, for sharing that role of a facilitator. So for everyone's reference, like Prosper has mentioned, so the facilitator is mainly the moderator of the session, right? They're trying to moderate the whole discussion according to the agenda that has been set for the session. So they invite all the relevant people onto the platform during the session, all the presenters, they moderate the case presentation, first invite the case presenter, then invite the expert for their opinions, and then track the recommendation, and then open it up for discussion. And also an important thing to note is creating a safe learning environment for all your spoke participants while the session is going on, right? So overall, that's the responsibility of the facilitator. So I'd just like to ask the audience over here, does anyone have any questions for Prosper related to the role of a facilitator? Anyone has any questions? All right. If not, we'll circle back again to you, Prosper, for this. And like you said, we'll now invite your program coordinator. So Azu Kaigo, I apologize if that's the incorrect pronunciation of your name, but please go ahead.
Okay, thank you very much. I think Prosper has said virtually everything. I will start by saying that depending on your structure and your capacity, a particular person can play double role. For example, from what Prosper has said now, he has told us that we have in Nigeria here, we are running two ECO programs, the SpiceEco and the West African Regional ECO. And Prosper, as the facilitator, also does some work of the coordinator. I am principally the coordinator. I also do the work of facilitator for the West African Regional ECO. As you can see my background, the map of West Africa, according to what Prosper said, it was conceptualized during the COVID-19 pandemic to train incident managers and health workers on COVID-19. But currently, due to the fact that COVID-19 has waned, there's COVID-19 fatigue, we have diversified into other diseases of public health importance and program areas. So essentially the work of a coordinator, the coordinator is the fulcrum of the ECO, in the sense that if the coordinator does not do his or her job, there can't be any ECO session. So the coordinator oversees the program and ensures sustainability of the program. What I mean by that is that he or she works at the background to ensure that the sessions are held regularly. So when you see the facilitator facilitating a session, for that session to hold, the coordinator must have done his or her job. And what the coordinator does, like I said, is the fulcrum of the program, is the coordinator that links the hub, the spokes, the subject matter experts, the panelists, the IT support. The coordinator is just in the center of it all. And before the ECHO session in particular takes place, for example, depending on your structure, if the ECHO program is already well structured with a, let me say, a curriculum in place and already have subject matters in place, is the coordinator that will look at the curriculum, know what topic to take at a particular time, and the subject matter expert that will be assigned to each topic. And he doesn't just stop there. He goes ahead with mails, follow-up mails, phone calls to ensure that each subject matter expert and panelists know when they feature and on what topic they are supposed to speak on. And he follows up to ensure that they actually show up. Sometimes the subject matter expert, after fixing appointments, they may have completing appointments, and some might even forget because they are very busy. It's the duty of the coordinator to ensure that he keeps reminding them. And sometimes just before the session takes off, the coordinator will still make calls to ensure that they are all on the program. Usually the coordinator is not seen, he or she works at the background, but like I said at the beginning, the impact of the work is what you see during the session itself. And after the session, the coordinator also sends up follow-up mails to all the participants, send the sessional material to participants, and if there's any challenge through mails or anything, is the coordinator that will continue working on that. And during the session itself, the coordinator also still doesn't rest, because he or she will liaise with IT support to ensure that as far as ICT challenges are concerned, they are all rectified, while the facilitator is the one that everybody gets to see. But at the background, the coordinator is still working. So it's the coordinator that links every team member of the ECHO program together. Is the coordinator that brings the participants. Is the coordinator that interfaces between everybody, the participants, the SMEs, the panelists, the facilitators, and the rest of them. Sometimes facilitator can come from one particular place, maybe the hub, but sometimes also the facilitator can come from other organizations. And the facilitator does not have to be a subject matter expert on that particular topic, but he also has to have an idea of what it is. So it is the coordinator that finds who will do the facilitation for any particular, on any particular topic or in any particular session. So in summary, the coordinator is just at the center of it all. And if he or she does not do his work well, the session that you see will probably not go well, because it's the coordinator that brings everybody together and hold them together and ensures that the program runs smoothly. Thank you very much.
Thank you, Dr. Azuka. Also, just to add, I think she has properly extrailed the role very well. You also need to understand that part of the role of a coordinator is that the expansion of program lies in their hand. Like for us in Nigeria, we have been able to expand so much in states. We have coverage. We also expanded so much in facilities that are on the call. All these things are coordinators' role, because they are going to be the one reaching out to CDC, making a case for expansion, making a case for, even tracking the reduction in terms of participation and all of that, and set everything in place. Like today, we are having a co-session. I am in another state. I won't be able to, I'm not the one facilitating. As someone who also coordinates, I've assigned Dr. Azuka, who just spoke, to facilitate today. But she doesn't know every other thing. Every other thing I'm doing at the background, I have sent her those who are going to speak. I've sent her those giving remarks. I've prompted the subject matter experts. I have also sent invitation mail for people to join, but I am not there. But what the Nigerian people will see today is Dr. Azuka, who will be the facilitator for today's eco session, and not me, who is the coordinator. Do you understand? So there's a lot of work going at the background that is led by the coordinator, and then we project the facilitator, and people see the facilitator and all of that. And even during the session, despite the fact that I'm in another state doing program, I'm still going to join to monitor activities background, because her camera is on her, that is limited to what she can do. But as a coordinator, you are the one making sure that she is seen well, that everything she is doing is perfectly done. So I just thought I should add that. Thank you very much. Over to you.
Thank you. Thank you, Prosper. Yeah.
Sorry,
Yeah, go
before
ahead.
you just come on,
Yeah.
in addition to what Prosper has said, I know he has mentioned program expansion and also program content. That is the work of the coordinator. I did say in the beginning that depending on your structure and your capacity, the coordinator or facilitator, one person can play more than one role. In the case of Prosper and I, for the 2 eco sessions we run, we do the 2 of them. But you still have a situation whereby the coordinator will be a separate person and strictly coordinating, and the facilitator will also be a different person and strictly facilitating. In our own cases, we do the 2 together. He mentioned about expansion. For example, for the Spice Eco that we're doing in Nigeria, we have expanded beyond the few health facilities that the Eco program started with to hundreds of facilities currently. And then in the West African region, we have noticed that when we came on board, we started off with just about nine countries from where people log on, but now we have as many as 58 countries. So my role as the coordinator here in the West African Regional ECO, I liaise between Nigeria, that is the hub, and other West African countries, Cote d'Ivoire, Ghana, Liberia, and the rest of them. And our subject matter span across the West African countries, and even across the globe. So it's my duty to reach out to them, to bring them and ensure that they come onto the session and deliver their topics and their teachings. So the coordinator, like you said, now today I'm going to coordinate the Spice Eco, while he, though he's not even around, he's doing the coordination at the background. And that's why I said at the beginning that you don't get to see the coordinator, but what you see during the Eco session is the facilitator. But before that facilitation comes into place, the coordinator must have done his or her job very well. Thank you very much, and over.
Thank you, Azukaigo. And I think you very well explained the role of a program coordinator in a very comprehensive manner. So I'll quickly again summarize this role. So the program coordinator is mainly the point of contact for all your stakeholders in the ECO program, right?
Yeah.
Mainly the hub team and the spoke participants or your learners. So any logistical information or any resource materials that need to go out from the hub team to the spokes, that goes through the program coordinator, and vice versa. If there's any communication the learners want to put forward towards the hub, that goes through the program coordinator as well. So all in all, it's a very comprehensive role. I'm sure you got a decent idea when Azukaigo was talking about it. And we also have Dr. Abrar over here, who's also playing the role of a program coordinator. Dr. Abrar, would you like to share your perspective on this as well?
Oh, thank you so much. As my colleagues have mentioned before, it's quite similar. In Sudan, we have around 5 eco programs that has been developed so far under Sudan Eco Center of Excellence. We started with the CMRT Eco 1 year ago, and now it's ended. It was mainly focusing on COVID-19 and the home management of COVID-19 cases in Sudan. And this is pretty much what we have started with. As an organization, we were looking forward to support the overall health system at the time of the peak of the COVID-19. But we needed to train people, and we needed to train them remotely, because socializing and being in a physical place at the time, it was difficult, as you know. So we used the ECO platform for our training, and then we placed the different volunteers in their neighborhoods and to deliver the services that we have trained them on. So basically, after our first mission has completed, we shifted to the primary care CMRT ECHO, and CMRT, it stands for the Community Medical Response Team ECHO, and then we had the Leadership ECHO, and it finished last month. Also the CRT ECHO, at where we combined another team from engineering for waste management, basically, and then we have the Jazeera ECHO, and it's mainly community medicine oriented ECHO, and then basically the roles are quite similar as my colleagues has mentioned, but we had many people who are coordinating the ECHO, the different ECHOs according to their areas of expertise. Like for those who are working in the community medicine oriented ECHO, they have the background of community medicine, because sometimes it's quite overwhelming and sometimes it's quite difficult to have a subject matter experts, for example, to cover the specific topic. Or as you all know, the situation in Sudan, it's a little bit hectic when it comes to the political situation, and most of the people, they run out of connectivity most of the times. So the coordinators at some point, they do cover the other role of the subject matter experts as well in some ECHOs, like the community medicine ECHO, for example. And as they mentioned before, it's just about having your schedule and your timeline ready ahead of the ECHO itself, and to contact the participants. And most of our participants are actually students, and this was another challenge for us, because we have to schedule most of our ECHOs to match their different schedules and their different times. So we usually conduct our ECHOs at the end of the week, at the weekends, after we consented all of the participants, and we agreed to have them at the weekends time. And we usually have the ECHOs towards the end of the day, and this was a challenge for most of those who are from ECHO India team because of the time differences, but we managed to have it. One of the challenges also that we had at the beginning were the subject matter experts, also to match their time and their schedules. And most of them, since we have a limited internet access at that time, we used our connections to have some of the subject matter experts from outside the country, and that was so beneficial at some point to manage and to run the ECHOs smoothly. And basically, it's just a mailing list. We usually prepare our mailing list for the participants and also for the subject matter experts. We usually check on the subject matter experts a week ahead the itself. And also we have a backup sheet where we ask the particular subject matter expert to give us a backup person who can replace their place in case if there is any emergency or they can't conduct the session at the time. So if you can consider having a backup sheet, that would be amazing. So we have usually like 2 to 3 backups in case anyone had to apologize or not able to deliver the session. So we have another people who can actually cover it for us.
Thank you, Dr. Ra, for sharing your experience. So more or less, what I would just like to say is more or less the program coordinator's role is the same in any ECHO program, but depending on your geographical location, the country you're working in, the type of participants you have, there can be slight variations in your roles. That depends hub to hub. So like you can see the minor differences between what Azukaigo and Dr. Brar have mentioned. But overall, the point is to be the point of contact for all your stakeholders, sharing all the logistical information, keeping in touch with them, sending them reminders, etc. Right? Any questions so far? Any questions from anyone related to even facilitator role or program coordinator role? Any questions anyone would like to ask? Any discussion points anyone has? All right. I think there is a question on chat from Itu Maleng, and the question is, how do you facilitate all 19 clinics in 1 hour, or does each state have its own echo session? So I think, Prosper, that question came right after your talk. So if you would want to answer that.
Okay, thank you very much. How do we facilitate 19 states? So we have a national ECHO program in Nigeria that is focused on HIV and AIDS intervention, treatment, care, and management, as well as other non-NCDs, non-communicable diseases, and we feature sometimes special ECHO sessions depending on the public health needs at the moment. So everybody joins, like we used to have at least up to 500 or 600, and because it's a national program, it is not disintegrated by states, because Nigerian government has one goal of which is towards 95 UNAIDS, which is making sure that 95 of all the individuals that Nigerian, all the people that are HIV positive know their status, that 95% of all those who know their status have access to ART drugs that they are on drugs. And then the third 95 is that also that 95% of all those that are on treatment have been viral suppression. So it's it's a national project. So everybody connects at the same time in those 19 states, and at the end of the presentation, just the way we are, people ask questions, we try as much as possible to, take question. And what we are talking about here is facility. So maybe in one hospital, there may be maybe 5 people connected from that hospital, and all of them are seated in a place. So if there are questions, maybe the lead of ECHO there will not ask the questions and they will provide. So we do it seamless. We can also share the link for our ECHO sessions right from 2020 up until date. And then you can see how these things are being done and how people ask questions and get response. So it's not a very big conference. So I'm dropping the link right on our blog if you want to see how we do it, and then you understand. So that is it.
Great. Thank you, Prosper, for answering that. I hope that answers your question, Itu Maleng. If you have any follow-up questions, you can feel free to unmute yourself, or you can put it on chat again. Anyone else has any other questions for our panelists? Any other questions?
Thanks, Prosper. Can you hear me?
Yeah, I can hear you.
Yes, thank you. The link will be very helpful. So in terms of the case presentations, how do you handle with the 500 attendees? Is it the subject matter experts that will present cases, interesting cases or complex cases after the short didactic lecture, or you don't really do the cases? I didn't hear you speak much about those ones, like complex cases from the participants.
Okay, so how we do it in Nigeria is that we have 4 implementing partners, now 5 implementing partners that are supported by CDC. So each of them, the 36 states of Nigeria, each of them, the states are shared to each of them. So what we do is that every month, every last Thursday of the month, the IP, one of the IP will provide a facility that they support to give a case presentation. So the case presentation is once in a month, last Thursday of every month. The IPs would appoint a facility under them to make a case presentation. And after they finish the case presentation, then the panelists that are on the call will, guide them, ask questions. Maybe the time they change, for instance, maybe TB HIV co-infection, and then the time they move, maybe the patient has the good drug resistance and they needed to move from first line to second line. You ask, okay, why did you delay to this point before moving to the next drug, maybe second line, or just ask few questions and also let them know that in such cases that so drugs is the best to manage the kind of the case. So it's a very simple technique. It's once in a month. The same a facility will present not to, so that at the end we'll have ample time for questions, reactions, and corrections. And then we also have Federal Ministry of Health on the call to provide guidelines in case if there are some that need, that need government or need to share current guidelines in terms of how to manage or handle such case. Yeah, I just dropped the link on chat now. If you use that link and join, you just stress last Thursday of every month is our case presentation, and you will see how it's been done. The last one we did, which is last week, was a case presentation, and it was wonderfully done. We have about 2 professors that joined the call, and they were able to handle it effectively. So this last Thursday is the typical case that you may want to watch and see how it's been done. And the link is on the chat box now. Yeah, thank you very much.
Thank you, Prosper, for answering that. I hope that answers your question, Dr. Xavier.
Thank you.
All right, great. So we have a couple of interesting questions from Matilda, and we'll start with the first one. So maybe Prosper or Azuka, I go.
Please, I'm in a meeting. Call me later, beg. I'm in a meeting.
Thoughts on that? How do you get people to participate?
Okay, thank you for the question. Yes, you know that it's quite difficult, like if you can't like meet people in person or you don't know them ahead, it's quite difficult to have the commitment. But before starting the ECHO, we have already started to train them at their neighborhoods. Like we had a coordinator and a volunteer who's coordinating the training at the neighborhoods, and this is how we started at the beginning, and then we knocked other doors in other areas to work in. So at the time of the COVID-19, people were excited, and there was no many activities like to conduct or to have, and most of our participants there were actually linked through their university. Motivation, like it was coming from the collaborative action, and that communities, they would like to participate, but there were no activities on the ground to conduct. And also one of the things that has facilitated the participation, we connected with the local universities in each and every city as possible. Now we have participants in 13 different states out of the 17 states in Sudan. So what we did, we connected with the universities, and we have placed an ECHO sites at these places. So it was easy for the participants to go to these halls, prepared halls, and to join from these places, because the internet connectivity was an issue, but all the universities were actually supplied with a constant internet connectivity. So that was part of the motivation of the participants. And most of our ECHO programs, they were not compulsory, like you don't have to attend each and every session, but it's optional to choose what kind of session you would like to attend and what kind of session you would like to join. And this has also helped and motivated the people so they can have a break and then they come back and organize their schedule accordingly. And one of the most interesting things we had, that we used the ECHO to teach and to train, but we had an implementation space as well. So whenever you are trained, you go and implement in your local environment and in your neighborhood, for example. And this is what pretty much vivid in the COVID-19 ECHO program that we had at the beginning of our journey, where we had in total 2,000 participants who attended the ECHO sessions and the training, the COVID-19 training. And most of them, they worked in their local communities amazingly, and we were able to deliver more than 20,000 vaccine vials to 20,000 individuals in different places in Sudan, just from the ECHO training. And also we had a partnership with the Federal Ministry of Health, where we trained some of our facilitators, the outstanding facilitators and volunteers, and the ECHO participants to become vaccinators in their local environment and in their neighborhoods. So this has have assisted and raised the motivation and kept the participants, because it's not just about taking the information, but actually you can go and implement, you can learn, apply, and come back and give us feedback on what you did. And most of our cases that we had presented, they were from their actual experience, what they have faced within these communities. Thank you. I hope I answered the question.
Thank you, Dr. I think Azukaigo also wanted to share her inputs. Yeah, please go ahead.
Okay, I wanted to say something before the question was posed, but let me just add to the response that my colleague Dr. Lalin have said. It's pretty very challenging to keep their interest without coercing them. For example, like she said, the way was actually a response to COVID-19. So naturally, when COVID-19 went down, people's interest, of course, went down as well. And the peculiar challenge of which maybe also be the same thing with some other ECHO programs, was that at the beginning, the participants that were recruited were more of elites. They were not actually at the facility level, in the grassroots level. They were more of elites who, of course, after the inauguration and initial participation, they all went their various ways. So they only get to attend if they are interested in the topic, or if they feel like, or if they have the time. It's quite different from what we have in the area of Spice ECHO. Prosper will talk more on that, which deals directly with facilities in the hinterlands. And aside the facilities, they are being overseen by implementing partners who ensure that it is part and parcel of their regular duty every week. So for that, and also the demand there is a particular thing that they do every day. So it's not difficult getting them to be part of it. But in the case of which was for a particular period, it was meant to be a response. And of course, when the COVID-19 fatigue set in, naturally it should die down. But luckily, we have been able to steer it successfully away from COVID-19 to other diseases. And the way we have been able to at least keep people's interest without forcing them to be part of the session, one of them is taking on topics that are trending. There was a time we had a monkeypox. When monkeypox was trending, we had a session on monkeypox, and that recorded the highest participation we had so far, about 730-something participants. And incidentally, we have another WER session next week. It is normally done bi-weekly, and the next session is going to be on the 6th of December, and we're taking on the topic of malaria. Last one we did on Ebola. The last one we had was on Ebola. Of course, you know that Ebola had broken out in Uganda. And by that, it means that other West African countries and countries that are close to Uganda stand at a risk of Ebola being imported into their country. So naturally, that is also a trending topic that will draw the participants. And presently, we are trying to scale up in the sense of, apart from being at the national level, we're going to scale up to make it get down to the states and down to the facilities. And of course, that will involve structuring of which wasn't the case at the beginning. So we're going to put a little structure into it to ensure that states buy into it, and also the facility level at the hinterland, the way that the Spice ECHO is structured. And before the question came up, I wanted to say that as a coordinator, if you're just starting your program, you need to do a lot of work in terms of searching for SMEs. You need to go in search of those SMEs. You could use the snowball technique. You could visit organizations that, depending on the topic you want to take on, where you have the subject matter expert. For example, the topic we are taking next time is on malaria. I've gotten a contact from the malaria consultant, the experts that handle malaria in the country, and SME from there. So before you get a structure in terms of having curriculum and developing your curriculum and topics and assigning SMEs, where there's no curriculum yet, where there's no structure yet, you have to do a whole lot of work in looking for SMEs, because without the SMEs to be part of the session wouldn't hold. So you need to search for them. Either you use who knows who from one person to the other to be able to get at the right people. So currently we sustain the interest of people in the topics that we treat. We take on trending topics, we take on emerging diseases. And somebody asked a question about if we also take on cases like I saw something like mental case. We have had to handle that on where the drug abuse and the rest of them. So currently, there's actually no limit to the kind of topic we are going to take. It's no longer basically on COVID-19. And the next curriculum we are going to draw that will take care of next year, 2023, we are not only going to dwell on infectious diseases, we have done also non-communicable diseases on where hypertension and sudden death. So we will no longer restrict it to infectious disease. We are going to have infectious diseases, zoonotic diseases, non-communicable diseases, and we are even going to incorporate practical demonstrations, medical emergencies and practical demonstrations such as CPR, arrest of bleeding. These are the skills that the health workers in the hinterland, the facilities in the villages and hinterland need to have at the tip of their finger to be able to save lives. So we are going to incorporate all those into our next curriculum. Thank you. I'll be open to any more questions.
Thank you, Azuka. Yes, Prosper, you raised your hand. Please go ahead.
I think the question is, how do you get people to participate without making them feel right? Was that the question?
Sorry, your voice is breaking a little bit. Prosper, could you repeat?
What was the question? Is the question on how to get people to join EcoSession without feeling coerced? Is that the question?
Yeah, that was the question. How do you get people to participate without being coerced?
Okay, so for us or for SpiceEco, one of the key things is to create demand for it. You know, when you create demand for a session or for a program, it runs itself. What we have done, just in addition to what Dr. Azuka said, is that we are giving the facilities what they should have paid to get. We have a very robust content in our curriculum that, as I am here now, just yesterday, one of the participants that was where I'm training was sharing with me how he used to make her own presentation from the content we share on ECO. So we've been able to create that unending demand for among our health workers, that they are looking forward to learn every Thursday, you know. And then secondly, it's also the IPs we are working. Okay, in Nigeria, where there's a structure of CDC states, so all the implementing partners who have equipped these facilities to join the EcoSession also prompt them to join by providing them with all that they need, data and the screen and everything to join. So they are being reminded to join. And that reminder is not as important as the benefit that they are getting by joining the EcoSession. So if you want to improve your EcoSession participation, just make your content very rich. Don't develop content and give to them. Let the content come from them, because what we have done in recent time is that we went to do site assessment and we asked each facility, what area do you feel or do you need your capacity to be built on? So they were the one that told us, okay, we want to learn more about ADHD, advanced HIV drug. We want to learn more about counseling. We want to learn more about KP and all of that. So they told us what they feel they want to learn. And that was what constituted our curriculum for the last year. So they are looking forward to be educated on those areas. So they are not coercing them, rather they feel that they are getting a favor by participating in the eco session. That's the operation in Nigeria.
Thank you, Prosper and Azukaigo. Yes, Dr. Abrar, please go ahead.
Thank you so much. I would like to add to what Prosper had just mentioned, and also to answer Matilda. She was asking about non-clinical sessions and
Right.
alongside with the how to keep your participant interested. For Matilda, most of our sessions were actually either combined or non-clinical. They were community-based, even if they were actually going around COVID-19 or the dengue fever. We had a dengue fever outbreak in Sudan during the past 2 months, or whatever the topic was. We usually combine both. So we give you the clinical knowledge, but and what do you need to deliver for the specific community or the specific area that you were going to implement this knowledge and to cover to bridge the gap in this area. So the first 2 programs, they were a combination of clinical and non-clinical. For the COVID-19, for example, we had some sessions where we're explaining in depth whatever that is related to COVID-19, the vaccinology, the variants, and all the clinical things that we're familiar with, and then how to deliver to the community, how to conduct, for example, health education, how to bridge the stigma, how to bring people to the vaccination site, and how to let people accept the vaccine and to stop all the rumors and the myths around the vaccines. Also, the community medicine echo, it's a family medicine oriented echo, and it's non-clinical as well. So it depends. And the leadership echo, it was a kind of, a parallel activity or a reward. It was actually a motivational. And also we have planned it to introduce another population to the idea of the echo and to have other people a part of the medical students or those who are in the health sector to join. And we had, as I mentioned before, some of our participants, they were actually engineers. So we had to separate the programs, and we prepared another program for them, which was the CRT, or the Community Engineering Program on Waste Management. Also, one of the things that could put like your participants in a high level of interest is the outcome and how would they actually outsource this outcome. During the past 6 months, we have been working on many abstracts, and we had 6 abstracts coming out of our experience with Eco India team and with the Eco platform in general. We have presented 3 of them in AfriHealth in Zimbabwe in August, and also we have 3 on the way to be presented in Rwanda. Also, we are working on the manuscript to highlight our whole experience and to publish it and make it available for others. So all of these things, they were actually motivational for our participants because they were conducted through the participants themselves. And whenever you showed commitment, we usually like scale up your position within the whole organization. Apart from being a participant, then you can be an eco facilitator and you can be an eco coordinator, and also you can actually be a coordinator for a teamwork program. And we usually conduct many parallel activities like agile team programs and the leadership eco as well. It was one of our parallel activities aside from the eco. And also we had something we call the CMRT Got Talent. It was actually motivational and kind of social and a social engagement for our participants to get to know each other well, because most of us, we haven't met physically before, and it was quite interesting, and this has actually created many bonds for us together and many friendships and many connections out of the eco. So you can plan, I think it's flexible enough to plan and to have many side programs aside from your main ECHO program and the main activity that you would like to give to your participants or to your specific community. Thank you.
Thank you. Thank you so much, Dr. Abrar, for sharing your thoughts on the question that Matilda had asked. And Matilda, I think, has responded good insights there. So great. Thank you so much. And just in the interest of time, I would also like to invite Anchal from our training team, who would just briefly talk about the IT support role now. That's the third critical role of a hub team. So Anchal, over to you.
Thank you, Palash. Hello, everyone. Nice to see you all on second day of partner launch training. So there are not very much, it's not very detailed that I'm going to talk about the role of IT support. Anyone from your hub team who is comfortable with the role, and it is not mandatory from our side that the person has to be an engineer or need to have an engineering degree to take up this role. But anyone who is comfortable with the role can take up this role. So I'll divide the aspects in three parts. So first will be before the session starts. So anyone who's taking up this role, they should make sure that the setup is done. So for example, let us take a scenario that you want to do a hub setup in office. You have a dedicated space where you want to maybe use all the equipments to set up. So then the IT support person, whosoever is taking up that role, need to make sure that the setup is done well before the session starts. Also to make sure that the connection are tested, that there is no bandwidth issue if you are facing. If there are any, then have a backup for the internet also that you have. In case of a virtual setup, then maybe making sure that the meeting is running safe, making sure that the meeting starts at least 30 minutes before the scheduled time. So like over here at Echo India also, whenever our immersion, whatever the time schedule our immersion is at, so we start our meetings 30 minutes prior to that, just to make sure that our internet connection is working properly, and also to make sure the devices are in well condition and are functioning well. While the session is going on, the IT support person will majorly have to facilitate from the IT standpoint. So there are few common issues that might come across, and the IT support person need to troubleshoot those. So for example, from a hub point of view, you might see that, okay, the spokes have joined in this session. Let us say the camera is also on of the participant, but it is not placed properly, that the face of the participant is not visible. Maybe the ceiling is visible, or maybe a chair is visible. So in this scenario, the IT support person will have to reach out to that participant, guide them that they're supposed to place camera properly. And if they're switching on the camera, then their face should be visible in the session. Guiding the participants and different members that are there in the meeting with few features like when to unmute and when to mute themselves. So for example, if the session is going on and someone happens to get unmuted from their end, and there's a lot of background disturbance that is coming in. So in this scenario, ideally, I would say the facilitator should make announcement for everyone, conveying the ground rules, conveying what is expected out of them. But let us say if the participant is not aware, then the IT support person has the access and they can mute the person from the backend also. The third aspect that the IT support person can help with is feedback error. So feedback error is a very loud screeching noise that we can hear, especially if multiple devices are connected to the same meeting and we sit in close proximate area. So the IT support person will have to help the members who are facing this issue to troubleshoot. Few of the solutions that we have is if everyone that is using their personal device, they connect, they use their individual earphones, or maybe if they sit in different rooms, or maybe if they want to sit in same room, then stay connected with audio from only one of the devices. Then let us say in a scenario, if there is a spoke, they are not aware of the basic Zoom features, then guiding them, making sure that everyone has the basic training. And so everyone has the basic training of how to access the Zoom before the ECHO program starts. Now, after the sessions have ended, the IT support person's major role would be to share any kind of report. So for example, we do have chat that gets downloaded automatically onto the device from which the session is being hosted. So maybe if it is required by the hub team, the IT support person can share the chat with the chat report with the respective members. Then let us say if the IT support person is also taking screenshots while the session was going on, or if they're recording the video, then sharing it with the respective members, however the process has been decided earlier. So a few examples of storing video file, especially because the file size is bigger. What other hub teams do, what I have seen them practicing, is that they create a private YouTube channel and they prefer to upload the various videos related to the session onto that platform. So the IT support person, if that is what hub team chooses, the IT support person can upload the various videos or the session recordings onto the YouTube channel also. So, talking about the aspect, if the hub setup is being done in the office, then the basic requirements that we have is maybe 1 or 2 HDTV set. So again, depending on the requirement, depending upon the area, completely depends upon the hub team if you would like to have that. A speaker, camera, and high-speed broadband internet connection. So that is pretty much it from the IT support standpoint. Any questions, any doubts, if you have, please feel free. You can unmute. You can also share them on chat.
Great, thank you, Aanchal. So that's more about the IT support role. If anyone has any questions, you can put them on chat or you can unmute yourself as well. Yes, Albert, please go ahead.
Thank you so much for the great presentation on the IT support. I was just wondering, considering that many times we may not have an IT support, and the coordinator may play the role of the IT support in the particular session. And considering that our internet connectivity is not very stable, what do you do to ensure that once your internet is down and you are disconnected, when you come back on, the messages that were posted before you were disconnected, you can still retrieve them? Because many a times, once you are disconnected, the chats that were posted before you got disconnected, you lose them. So what do you ensure? What do you do to ensure that, from your experience, to ensure that you can still retrieve those chats? Thank you.
Thank you so much for that question, Dr. Albert. So like you've correctly mentioned, I personally have noticed this. So every time I get disconnected from a meeting, I see I'm not able to see the chat. So if we are talking from an aspect wherein the questions are to be addressed from the chat, or the participants are sharing their questions on chat, I would say what we do and what we practice over here at ECHO India is that different members from the team. So I understand that you may not have a specific person who will take up the role of IT support or program coordinator, but definitely I'm hoping that there will be at least 1 or 2 members more in the hub team. So maybe they can have the co-host access so that they can actually have the backup of all the chat that is available. And then if it needs to be addressed, if, for example, one of the member does get disconnected from the meeting while it is going on, there can be other member from the hub team or a representative who can address the query. I hope I was able to address the question.
Yes, that's fine. Thank you so much.
Most welcome. Dr. Mohammed, you've raised your hand.
Dr. Mohammed Jibe, you had raised your hand. You want to ask something?
Thank you. Can you hear me?
Yes, please go ahead.
So the issue is in relation to communicating with individual members while the session is still happening, and technical aspects, as you indicated, for example, disturbances and so on, of people having their mics on when they should be muted. So I presume that hopefully one has an IT person, that this communication is sent via Zoom function. Is that the case, or does one need to communicate with them separately out of the session?
Okay. Thank you so much for that question. So what the ideal process is that once we are closer to launching our program, what I have observed is that there are different hub teams. They have a pre-launch session. So pre-launch session is the time wherein we can communicate our expectations to the spoke participants. If not just that, if the hub team feels that there is a special requirement from the spokes end, and if you feel like they should be properly trained as far as Zoom is concerned, how to use various features, what is expected out of them. So that can also be arranged, and that training is also provided to the spokes. But if I have to take an example, what we do and what we have seen other hub teams recommend is communicating. So facilitator in the beginning of the session, they can communicate all the ground rules and expectations. And also when the session is going on, let us say, for example, if I am a presenter and if I'm talking and someone happens to unmute themselves and there's a background disturbance. So the facilitator can immediately make an announcement, a generic announcement, without pinpointing it to the individual, making sure that everyone is aware and they're conscious that they are muted if they're not talking. So these are few expectations, few ground rules that we will have to get our spokes habitual of. Sooner or later, they will automatically understand what the process is, how it is expected for them to unmute, when to mute themselves. If not, let us say, like example that I was talking about is that someone happens to unmute themselves and they're not aware of it. So for such scenarios, the access has been provided to the hub team. You can mute the participant from backend also, just to make sure that the session does not get interrupted. I hope I was able to address the question, Dr. Mohammed.
Yes, thank you very much. Thank you.
Most welcome. I see there is a question on chat. How do you troubleshoot issues in remote spokes that do not have an IT personnel? So thank you so much, Dr. Moses, for that question. So when we talk about the IT support person is part of the hub team. So they will be allocated and they will be sitting along with the hub team if the sessions are being conducted from one place itself. So that IT support person is dedicated to troubleshoot any issue that the spokes or even the hub team is facing. And they will be connected in the session because the sessions are being conducted virtually. So if I have to quote an example, you can see that from our team also, we have an IT support over here. And if you search for IT, Echo IT, you will be able to see their tab. So similarly, I would recommend for your sessions also, maybe you can assign or maybe designate one person to take up that role. Make sure they rename themselves correctly. And you can also communicate it to the spoke participants that if they're facing any issue, they can reach out to the IT support person. They can either drop a message in the chat box or personally reach out to them. And like I've mentioned earlier, when I was addressing the question from Dr. Mohammed, make sure that you communicate the expectations when the pre-launch is planned. Or maybe if you feel like that there is a need of special training, then please make sure that they get that training, and we will conduct that training for them, wherein we'll talk about the certain aspects and what is important for them to, and how it is important for them to conduct themselves during the session. I hope I was able to address the query.
Yes, yes. Thank you. Thank you so much.
Thank you so much.
All right, great. So I think we're running a little short on time, but I would love to continue this session for a longer period of time. But unfortunately, we have other sessions to look forward to after this. So I'm going to stop right here, but still that doesn't mean that you all can't share your questions and comments with us on chat. We are still here. Even on different sessions, if you feel you have more questions for our panelists, Dr. Brar, Prosper, Azukaigo, or even Anchal, please put them on chat. We can forward it to them. And we also have the opportunity for Mr. Prosper to come back later in the day. He'll be presenting another session for you all. So you can always ask those questions in that particular session as well. So thank you, everyone. Especially thank you to all the panelists for taking out the time from their busy schedules and interacting with all our participants over here. It was a privilege to have you here with us. And Mr. Prosper, if you would like to give any last motivational words to our audience over here, everyone is looking forward to launching their ECHO programs. So if you have anything to add here.
Thank you very much. My last word would be that ECHO is, thanks to the initiative that brought about ECHO. It's something so nice. It's something that the world is looking out for, especially those in the hinterland, those that ordinarily will not be privileged to come to town or meet with the best of subject matter experts. ECHO has been able to bridge that gap by sharing knowledge, removing knowledge instead of moving people, and democratizing medical knowledge. So I want you to see it, take ownership of it. You cannot make it succeed as much as your passion towards it. So passion is very important. When you have passion about it, it will help to drive the process for you, and then you'll be able to get to your desired destination. So thank you very much, and it's nice to talk to you from Nigeria. Bye for now.
Thank you. Thank you, Prosper. Dr. Brar, if you have any last words for our audience.
Thank you so much for the opportunity, and I'm glad that I was able to talk to you all. And having an ECHO program is not just about your program or what you would like to share or deliver to your participants, but it's about unlocking a new experience and building connections, in a global level. And this is something that is, it will build, a more prosperous kind of communication, and it will expand your pool of experts, your knowledge, and also your experience, because now you're not limited to your comfort zone, but you have to deal with other kinds of arrangements and other kind of or big, or a larger scale of knowledge sharing. And you can reach out to me whenever you have any question or you would like to have any help from our side in Sidro or Sudan, from the Sudanese team. I'll put my email in the chat, and then we can talk, and I can answer your questions alongside with my colleagues. And also you can join our session. It will going to be next week. You are more than welcome to attend and to have an idea about how do we run our session. Thank you so much for the opportunity.
Thank you. Thank you, Dr. Brar. Azukaigo, would you like to add anything?
It's essentially said everything. ECHO is about moving knowledge and not people. And the original intent of ECHO is that the expert knowledge should be able to get to the health facilities, to the health workers in the hinterland, so that the patients or people who need care wouldn't have to travel all the way to the city in search of expert knowledge. And so the ECHO sessions are sessions where we share knowledge. Everybody goes away with something. And where we invite subject matter experts is for them to give us their views from a subject matter point of view, to clear sometimes the wrong impressions and the wrong knowledge that many people may have when they come for a particular, in regards to particular topics. That's the essence of the subject matter expert. But in essence, it is a knowledge sharing session where everybody learns. There's no person that knows it all. So you ask your questions, you bring up your challenges, and everybody deliberates in it. And above all, we have the people who are experts in particular areas bring in also their own point of views. And the echo session is meant to be dynamic. At the point where you see it is no longer being interesting, you need to look for something to spice it up. And when you start, you're expected to expand. So you don't just remain static. That is what tells you that the program is actually interesting to people. So it is something that's supposed to be dynamic and keeps moving. And as time goes on, you will be having other ideas that you can bring on board. Like in the case of the way now that was solely on COVID-19, but right now we have opened up everywhere. And we want to say our colleagues that have been here, we want to thank everybody for giving us the opportunity to be part of this session. Still reach out to us beyond this particular training session. Any challenge you have, any question, like you said, I think we also will drop our contacts on the chat box so they can always feel free to reach out to us. It's all about networking, all about knowledge sharing, and it doesn't just end here. This is just the beginning. Thank you very much for giving me the opportunity to be part of this session. Over.
Thank you. Thank you, everyone. Thank you to all our panelists. And I know there is a question from Beatrice on chat, but Beatrice, just in the interest of time, we'll move forward, but we'll make sure to get your question answered from our panelists. Thank you so much. And I'll just pass it back to Himanshi to move forward. Thank you, everyone.
Thank you, Palash, and thank you all the panelists on giving us insight on their respective roles. So in the interest of time, on this note, we will take a quick 5 minutes break and a timer will be set on the screen during the break. Hope to see you all back on time with your videos on.